Okay, the Rules Committee will come to order. Tonight we are here to consider H.R. 6201, the Families First Coronavirus Response Act. The World Health Organization today classified the coronavirus as a global pandemic. Already it is having a cascading impact in many communities. Workers have been forced to take leave. Consumers are staying home. College students have been told to leave campus. Local businesses are wondering whether they can afford to provide enough sick leave as foot traffic slows. And some schools are closing, leaving kids wondering where they're going to get their next meal. This virus isn't just a public health emergency, its consequences cut across many aspects of our society. And we need a comprehensive response that matches the scale of what we face. Congress recently passed a roughly $8 billion emergency appropriations package to deal with this virus. We said then that it was just the first step, and that's why we're here today. We need to send to the President's desk another package addressing the challenges that the American people are facing as this virus spreads through our communities. So tonight, we have this legislation. We've made it public, and with us we have the chairs and ranking members of the committees that have been working on this package. We will hear from them on this important bill, but we won't report out the rule tonight, so I will say that in advance. We will wait until the morning to give the administration a little bit more time to review it. If the administration has constructive feedback, we will certainly look at it, and I hope they are constructive, but let me be clear. We need to be on the floor tomorrow at 9 a.m., so I would ask people to work on this through the night. I know that the folks working on this have already been having discussions with the administration, so there should be enough time to get their input. And I will ask members of this committee to be back here early tomorrow morning so that we can report this bill to the floor. So let me close by saying that this virus knows no political party. Our response should not either. We must work swiftly, but we also must work thoughtfully and constructively to get these resources where they need to be and where they're badly needed right now. And I want to thank everybody for being here tonight. I want to thank you for all your work, and I want to thank you for your concern over this issue. So I'm now happy to turn to our ranking member, Mr. Cole, for any comments he may want to add.
Well, I want to thank you, Mr. Chairman. I want to associate myself very strongly with the spirit of your remarks. We're here on very short notice to consider a bill that's intended to address the ongoing coronavirus outbreak in the United States. This, of course, comes on the heels of the bipartisan coronavirus supplemental appropriations bill Congress passed just last week, and I appreciate your reference to that. Earlier tonight, the President of the United States announced executive actions to further protect the American people. I'm very pleased with the actions he announced, and I believe they will be positive. Although a difficult decision, expanding a travel ban to cover Europe will undoubtedly reduce the spread of this virus and will save lives. Of greater importance, securing commitments from health insurers to waive all copays for coronavirus testing and treatment will assist affected Americans. On the economic side, the President's actions to extend sick leave to American workers and his actions to expand small business loans for these critical engines of our economy will help protect employees and employers alike during this difficult time. The President's actions will go a long way toward protecting Americans, protecting employees, and protecting the economy. I want to turn now to the serious concerns I have about the speed with which the legislation was produced, but I want to tell you, Mr. Chairman, that's not meant as a criticism. Mr. Chairman, I understand, as I'm sure all members do, the gravity of the situation and the extraordinary times we're in. But I also must make clear that we learned a couple of days ago, through the press, mind you, that the Speaker's office was beginning to work on a bill. Just a few short hours ago, members of the majority party apparently received a closed-door briefing on the contents of this package. Minority was not given that same consideration. text wasn't made available until 11 p.m., and now the Rules Committee is meeting to consider a rule that will provide for consideration on the floor tomorrow. All of this comes before members receive our next briefing on the situation, which is scheduled tomorrow morning at 8 a.m. I want us to do the right thing, Mr. Chairman, for the American people. As I mentioned earlier, we provided roughly $8 billion just last week to accelerate testing, creation of a vaccine, and other emergency response procedures. As I've already outlined, President Trump is taking decisive, necessary action that I support and hope all of my colleagues will as well. I believe we will continue to accomplish more in the days and weeks ahead. In fact, I have no doubt there are many provisions in this 124-page bill that will also prove to be helpful and will supplement the President's actions. As soon as I finish reading it, I hope to discuss it with my colleagues. In the meantime, I look forward to hearing from our witnesses, particularly the Democratic ones, as to what exactly is in the bill so that we can all make the best decision for the American people. And again, I want to add just off the cuff, Mr. Chairman, I appreciate everybody here. I know everybody is working very hard together to try and make sure that we do the right thing. Again, I think the President did the right thing tonight. I have no doubt my colleagues on the other side of the aisle are working to do the right thing as well. And so I think we have an opportunity to come together, work together, do the right thing for the American people. So like you, Mr. Chairman, I look forward to the testimony we'll hear this evening. I also look forward to the discussions that I'm sure will occur in the hours ahead. And hopefully we can be here tomorrow morning and working together and providing much-needed reassurance to the American people for what we have to do and what's in their best interest. And look, I know everybody here, Democrat and Republican alike, that's their main objective, and I know certainly that's your objective, Mr. Chairman. So we look forward to working with you in this crisis and moving ahead in a positive way.
Well, I thank the gentleman, and I want to thank him for all of his attention to this issue. I mean, I'm very fortunate to have a ranking member who I think cares deeply not only about this institution but about doing what's right. And so I concur with everything he said. And we.
That doesn't happen often.
I know, but it happens more than people think.
Actually, it doesn't.
Right. So, in any event, I'd like to welcome our witnesses to provide testimony on H.R. 6201, the Families First Coronavirus Response Act. We have Chairwoman Lowy, Ranking Member Granger, Chairman Pallone, we have Mr. Burgess, Chairman Scott, Ranking Member Fox, Ms. Sewell, and Mr. Estes. Anything you brought in writing will, without objection, be entered into the record. And I would just encourage you to be to the point and succinct, because we have a lot of you here today. And I now recognize the gentlewoman from New York, Ms. Lowy.
Oh, it's too late. It's working. I'm not sure I'm working, but it's working. And I want to say at the outset, I certainly appreciated the words of my good friend, Mr. Cole, and our distinguished chairman, and we all understand the urgency, and that's why, unfortunately, we're here tonight rather than tomorrow morning. So I thank you all the members of the committee who have joined us in doing some very important work. Mr. Chairman, Ranking Member Cole, members of the Rules Committee, while the $8.3 billion...
Are you sure that's on? Yeah, okay. There we go.
Okay. Is that better? Okay. Mr. Chairman, Ranking Member Cole, members of the Rules Committee, while the $8.3 billion coronavirus supplemental enacted into law last week provided crucial resources to our public health system, more support is needed to address the impact on American families. The legislation before you is appropriately titled the Families First Coronavirus Response Act. My friends, committee chairs, will tell you how this bill meets the needs of the American people by expanding free coronavirus testing, providing paid sick leave, protecting frontline health workers, and supporting strong unemployment benefits. In our section of the bill, the Appropriations Committee is ensuring food security by providing $500 million so low-income pregnant women and mothers with young children who lose their jobs or are laid off due to the coronavirus can access nutritious food. $400 million to help local food banks meet increased demand from low-income Americans during this emergency, and $250 million to provide home-delivered and congregate meals to low-income seniors. Critically, the bill also provides SNAP flexibility for low-income jobless workers and ensures that children who depend on free and reduced-price school meals have access to nutritious foods in the event of school closures. Mr. Chairman, this bill will help ensure the physical safety and financial security of our nation's working families during this time of crisis. I request an appropriate rule to bring it to the floor. Thank you, Chairman.
Thank you very much. Ranking Member Granger.
Thank you for asking me to testify on this legislation. Unfortunately, this bill was pulled together very quickly, but I'm still reviewing it. What I do know is the President just laid out some bold steps to provide protection for our citizens and try to stop the impact of the coronavirus. He's restricting some travel. He also asked for more help for Americans having financial hardships, including small business loans, tax relief, and an assistance package to workers harmed by this outbreak. Some of the proposals may need legislation, language, and funding to implement. He also stated that 1 million tests have been distributed and another 4 million will be shipped out by the end of the week. Just last week, we passed an emergency supplemental bill with a nearly unanimous vote. We were able to do that because we worked together on a bipartisan, bicameral proposal. Because of that cooperation, that bill is now law. As we review this text, I'm not yet sure if this bill is one that my colleagues and I will support. The bulk of the legislation before us contains authorizing language that is outside the jurisdiction of the Appropriations Committee. I want to be sure there are not any surprises buried in the more than 100 pages of text. I also want to be sure the President has the tools he needs to combat this virus. I look forward to working with my colleagues, as we've done in the past, to continue to protect the American people. I think we all support providing relief to the Americans affected by the coronavirus. We must put partisanship aside and stop this virus from affecting our health and our livelihoods. And I thank you, and I yield back.
Thank you. Chairman Pallone.
Thank you, Mr. Chairman. I'm just going to try to summarize because I know the hour's late.
That'd be great.
Basically, we're trying to incentivize people who need to have the diagnostic test for coronavirus to receive it without the concern that they have to pay out-of-pocket costs as a result. So essentially, without getting into the details, unless you want to, whether you're in the Medicare program, Medicaid program, whether you're in the Indian Health Service, or you're getting your insurance privately, or you have no insurance, we're trying to make sure that you can go and have the test done without having any cost, whether it's deductible, a copay, or just outright, paying, not having to pay for it if you have no insurance. Now, I could get into the details of how we effectuate that, but I won't too much because the hour is late. In some cases, obviously, Medicare covers this, or the President has issued certain rulings. In other cases, it doesn't. So we basically fill in the gaps and say that everything has to be covered without any copays or deductibles. But I did want to mention two things, and that is for people who don't have insurance, there's flexibility in this, so the states can basically cover them through Medicaid or have them enroll in Medicaid without having to meet the income requirements that we have now. And they would be tested, and that would be paid for under Medicaid solely for the testing for the virus. And then we also have a pot of money that goes to the National Disaster Medical System to pay for the uninsured. And so essentially, if someone goes to a community health center, for example, and they have no insurance, it would be covered with that, as an example. And then in addition to that, because we anticipate that a lot of people will lose their job or end up with a part-time job because of the economy, we increase the FMAP. In other words, for those states right now, as you know, depending on the state and the level of poverty in the state, have to pay at a minimum 50%, or the federal government pays at a minimum 50% of Medicaid costs, and that's matched by the states, depending on the state. And so the FMAP provision increases that federal match by 8%. And this is for Medicaid in general. In other words, anticipating that a lot more people will have to be covered by the, go on to the Medicaid rolls. And then I did also want to mention the masks, because there's been a lot of concern about that and whether or not masks for healthcare providers would be available. As you know, the companies have asked for liability exemption, and that has been the case in the past when we've had other public health emergencies like, I don't know, Ebola or some of the other things that we've had for vaccines and other things. So we do extend that for a limited purpose. So if the mask is basically approved by the federal government, and during the time of this emergency, as declared by the President under the PrEP Act, there would be the liability exemption for those masks, so that we make sure that they're out there and they're distributed. And I think that's about it. That's under my jurisdiction.
Thank you. Mr. Burgess.
Well, thank you. Thank you for letting me be part of this panel to testify this evening on behalf of the Republicans on the Committee on Energy and Commerce. Like my ranking member on the Rules Committee, I do have some concerns about the process, about how this came together. I just saw the text for the very first time when I walked in here. I had a chance to read the first 4 lines on the first page. Look forward to reading more of it between now and 8 o'clock in the morning. I know members, certainly my members on the Republican side of the Energy and Commerce Committee will have questions. I will tell you, as the Republican leader of the Energy and Commerce Subcommittee on Health, I've been tracking this outbreak for some time, since the stories broke over in China about a rather different type of pneumonia that was being encountered. I've been concerned about this. I've been here through several infectious diseases, starting with SARS, going through 2 versions of the bird flu, the swine flu, Zika, Ebola, and MERS. This one worried me more than any of the previous illnesses. Part of that is because it's a respiratory virus. It is transmitted through respiratory means, and it is a virus that may have a long latency period between the time someone becomes infective and the time that someone actually has symptoms. And for that reason, the super spreader phenomenon that we've seen in several locations, I think, has been a feature of this. I think we did delay the worst part of this virus for 3 or 4 or 5 weeks by putting the travel restriction with China, and I think that was important. I think that was a bold step by both the President and the Secretary of Health and Human Services when they announced that unprecedented quarantine at the end of September. The question then arises, did we use the time that we had to the best of our ability? And I think there are some legitimate questions about testing and how the testing came about and what were the problems with testing. Were there some of the rules that we changed back in 2012 that contributed to the delay in testing? And I think we as a committee should look into that. We do need to have the oversight into the testing, not so much to assign blame, but for the lessons learned. This won't be the last time we face a problem like this, and if there are things we can do better next time, we should. I do want to say that just like Ranking Member Cole, I watched the President's speech tonight. I was encouraged by his speech. I was encouraged by the types of action that have been taken by the executive. I do want us to step up and provide some of the things that were described in the President's speech tonight. I am for one, grateful that we have a president, a leader who is not afraid to lead on this, and I think that is important. We all want to provide our country with the necessary resources. That was clear a week ago when we passed an $8.3 billion emergency supplemental to ensure our frontline health care workers and state and local public health departments would be able to adequately handle the outbreak. Funding for vaccine development is important. We know that takes time. Dr. Fauci has related that to us on a number of occasions. It is important that the vaccine be established as safe. I am old enough to remember an episode of the swine flu during the Ford administration where a vaccine was hastily developed and its administration was mandated across the country, and some serious complications occurred, and we certainly don't want to repeat that. So once the vaccine has been established as safe, Dr. Fauci has assured us that he will proceed with all dispatch to make sure it is effective, and it will be brought online as quickly as possible. And I think we have provided the funding to allow them to do that. Some of the things I'm just learning about this evening about the FMAP increase, I'm interested in that. I know from our previous experience with the stimulus bill in 2009 that can be a significant score by the Congressional Budget Office. So I think we need to know that. We need to pay attention, and we certainly need to understand what we're buying. I would stress that the Energy and Commerce Committee needs to have the types of hearings that we should have in Energy and Commerce. We are the authorizing committee. Our work on this problem has been pretty tangential, and that has been disappointing to me. I do want us to work together. I think we have good ideas on both sides of the dais, and I think those ideas ought to be brought forward. One of the things that I would have liked to have talked about had we had the opportunity to do it was there's an actual bill out there, H.R. 4870, and Eshu and I introduced it, the United States Public Health Service Modernization Act. It's been on the docket for some time. It is a technical fix to existing statute to allow our Ready Reserve Corps to receive retirement and other benefits. Obviously, the Ready Reserve Corps' purpose is to fulfill the needs to have additional Commission Corps personnel available on short notice for public health emergency response missions, so the United States Public Health Service assignments in many of our congressional districts are without interruption. I think this is common sense legislation. It could have been added to this package. Well, maybe it can be before 8 o'clock tomorrow morning, and I think that is something we should look at. Again, it's bipartisan, and Eshu, the chairman of the Health Subcommittee, and I were the ones that introduced that bill. I will also say I've been encouraged by some of the antiviral development that we've seen happen, and surely the reports that are coming back have been anecdotal to date, but as that is the only tool that we have to fight the infection of this virus, I do think it's important to pay attention. I would like for us to examine whether or not it would be possible under either compassionate use or right to try to allow some of these antivirals to be administered in the Medicare and Medicaid system and to be reimbursed without having to go through a lengthy coverage determination by the Centers for Medicare and Medicaid Services. Again, had we had the time to evaluate this in committee, that is one of the things that I would have liked to have seen us accomplish. I would like to hear what Dr. Fauci has to say about the package. Is this evidence-based policy? Is there, are we doing things that will make a meaningful difference in the response? Of course, we're all reminded constantly of the measures we can take individually, measures that really don't cost much, things like hand washing and social distancing, sort of non-pharmacologic interventions that are available to all of us. If anyone doesn't think that social distancing plays a role, I urge you to Google Philadelphia and the Spanish flu and read about the experience in that city at the near the conclusion of the First World War during a Liberty Bond parade where the director of health for the city thought it would not be a problem, allowed the parade to continue, and many more people in Philadelphia were infected and died as a result of that. Social distancing matters. It doesn't cost a lot of money, and it is something that, that people do need to consider. Look, we've got a lot of unknowns. I think this disease is of such significance that it requires us to be careful in how we proceed, but I also understand we need to proceed with dispatch. So I look forward to being able to read the bill during the latter part of the evening and look forward to joining you early tomorrow morning.
Thank you very much, and I will point out to the panel that Mr. Burgess is also a valued member of the Rules Committee, and so we care very much about what he says. I will also say that I, too, saw the President's speech tonight, but in the spirit of trying to be constructive and positive, I'm not going to comment on it. So having said that, we'll yield to Mr. Scott.
Thank you, Mr. Chairman. Ranking Member Cole, comments have been made about how quickly this has been put together. We have an emergency, and I don't think we have much choice. I'd like to spend a lot more time on the legislation, but the more time we take putting it together and getting it out there, people will die. And so we've done it as quickly as we possibly can, and everybody would like more time. Mr. Chairman, there are several provisions of the legislation that come within the jurisdiction of the Committee on Education and Labor. First is an OSHA provision. There is a need to have OSHA promulgate regulations, especially a temporary, emergency temporary standard that will require health facilities to implement comprehensive plans to keep frontline healthcare workers and others affected safe during the epidemic. That is, to keep them safe from any communicable disease. OSHA currently has no standard to protect workers from airborne diseases, and obviously that's a problem here. Now, there is CDC guidance, but guidance is not enforceable. We need OSHA to promulgate regulations that OSHA can enforce by law. There is pending regulatory standard, and the department needs to promulgate those regulations. It affects healthcare workers and others affected. That would mean first responders, even workers who clean planes after, anybody affected by infectious disease. The second has already been referred to, and that is making sure that all health insurance plans cover the full costs of testing. In our jurisdiction, we have ERISA plans, employer-provided plans, and so those plans need to step up and make sure that there's no copay and deductible, so no one is discouraged from getting tested. Another provision involves school lunches. When some public schools are being closed and young people are going without lunches, there are several things that the Department of Agriculture can do in terms of waiving standards. One, if the school closes, they can go on essentially the summer protocol where the students don't have to be all in one place at the school. You can have the distribution as you do during the summer, so we're not inventing anything they don't know how to do. But you need waiver authority for that. There's also a provision that when you have these waivers, that they can only be done if there's no cost increase. Well, if there's a little cost increase, we don't want that to be a problem, so we have a provision in the bill that waives that. In the final version, and for the school lunch, is a pandemic electronic benefit transfer program, a PEBT, that provides emergency food assistance to a family when there is a prolonged school closure so that the family can get nutrition. Finally, the Act provides that for a 14-day paid sick leave provision, and after that, sick leave availability. People ought, if they're not going to get paid when they self-quarantine, you have a real disincentive to self-quarantine. If they know they're going to get paid during that time, they can protect the public by self-quarantining. And if you're not paying them, you have a very serious disincentive for public health. And so this provides 14 days of paid leave and a 12-week partial paid leave after that. So people who need time off, time to be with their sick family members can do that and without endangering the public by working to make rent.
Thank you. Ms. Fox?
Thank you, Mr. Chairman. I'm always glad to be back at the Rules Committee and very happy to see the bipartisan nature of the chairman and the ranking member. When I heard about this bill today, I remembered something that a well-known Democrat said, "Never let a crisis go to waste." But then I also remembered the phrase, "act in haste and repent at leisure." And that's the kind of thing that troubles me the most about this. I just don't think we should be legislating with very costly, far-reaching legislation dropped minutes before hearing, as everybody has alluded to tonight, hours before a vote, and crafted in a wholly partisan manner. That's very troubling because we, Chairman Scott and I have tried to be a model committee, and we have worked very, very closely together, and a good part of this bill comes under our committee jurisdiction, as he has pointed out. And I think actually about the only bipartisan part of the bill, as I understand it, is legislation that from Representatives Bonamici and Comer that our staffs have been able to put into the bill. And I'm very happy to see that. But we'd like to see more bipartisan work done on this piece of legislation. Mr. Cole mentioned that, and I think all of our colleagues on our side of the aisle feel very strongly about that. I did think the president made a very fine speech tonight urging us not to make this a partisan issue. And I was not here on 9/11. I came afterwards, but I understand, you know, there was great coming together in the country and in Congress to respond to that. And I think that's the way we should be working now. There are a lot of troubling provisions in this bill that are not related to the coronavirus. And that's where the never let a crisis go to waste piece comes in. But I don't think we should be pushing priorities that don't fit into the situation we face. We need to know that our solutions are not unduly burdening those most affected by this evolving situation, especially small businesses, employers, and taxpayers who are going to be saddled with the cost of this. There are a lot of personnel and revenue disruptions at the same time with these businesses, and they're being forced to absorb new mandates and costs, and that troubles me. I think that many of the proposals would further hinder the viability and recovery of the employers by burying them under bureaucratic red tape and saddling them with unnecessary record-keeping requirements, exposing them to additional legal liabilities. Again, I think we act in haste and repent at leisure. I don't think we can anticipate in a hurry the kinds of things that are likely to come about. I appreciate what Chairman Pallone has said, but I'm not satisfied that we've thought through all the possibilities. I don't think we should act preemptively on permanent regulatory changes that have unknown impacts without thorough analysis and opportunities for public comment. I think this is just a brief commentary on a handful of concerns with the text of this legislation, and that's all it's possible. We've all commented on the fact that we haven't had time to consider this very expansive legislation. And again, I wish it had not been so partisan so that we could recommend common sense fixes, such as allowing companies to provide assistance to independent contractors without penalty, or helping U.S. students enrolled at foreign schools complete some of their instruction here at home. I know that there's a problem out there, but I think, again, we may do more harm than good by acting in such a hasty manner. So I hope the House will reject what I consider premature partisan legislation and get back to the negotiating table to work out a bipartisan solution that will help Americans suffering from the health and economic consequences of the coronavirus. Thank you, Mr. Chairman.
Ms. Sewell.
Chairman McGovern, Ranking Member Cole, I am pleased to appear before you this evening to discuss the important legislative package to protect America's health and financial security in the wake of the coronavirus. Members of the House Ways and Means Committee have been closely following recent developments and considering appropriate legislative responses. I want to highlight 3 policies within the Ways and Means jurisdiction that have been included in the measure today. First, ensuring that COVID-19 testing is provided free of charge. Secondly, standing up a new emergency paid medical leave program. And lastly, implementing measures to stabilize the unemployment insurance system and make sure workers can access earned benefits. First, it's imperative that anyone who needs to be tested for the coronavirus is able to access and afford that testing. This will obviously require that our healthcare professionals have access to the tests, which unfortunately still is not the case. It also means that Americans cannot worry about how they will afford the cost of the test. Working with the Energy and Commerce and Ed and Labor committees, we have drafted provisions that will ensure free testing for COVID-19 in all of the major programs, Medicare, Medicaid, and CHIP, as well as for people enrolled in private insurance and for the uninsured. As a representative of Alabama, a state that has not expanded Medicaid, I have a large part of the population that I represent that fall in that gap and are uninsured, working poor. And it's really critically important that we make sure that we have language in the bill that will allow for the uninsured to also get free testing. Secondly, it is critical that we provide financial support for American workers affected by the coronavirus. As we face this public health crisis, Americans must not be able to miss their mortgage payments or be unable to afford groceries because they cannot work. Provisions in this measure establish an emergency paid leave benefit modeled on the Family Act. Workers will have to take leave due to coronavirus, including those in quarantine and those dealing with children or child care closings, will be eligible for this new benefit that will be provided by the federal government. As in the Family Act, the benefits will be administered by the Social Security Administration. We will have provided both dedicated administrative funding, firewalls to make sure that this doesn't affect the Social Security Administration's ability to pay Social Security benefits on time. We will also leverage existing state-paid leave programs and reimburse them for the cost of benefits so that those states are not penalized for being good actors. The full cost of the program will be paid for directly out of the Treasury, not using payroll taxes. Finally, we have included needed improvements to the unemployment system. These provisions will immediately address access and administrative funding issues to help states deal with spikes in unemployment and prepare them for any future local and national recessions. The legislation will also provide states with federal flexibility to address some of the key barriers to unemployment insurance access for coronavirus individuals, things like waiting periods and work search requirements. Together, these Ways and Means provisions will help limit the spread of the coronavirus, allow Americans to access critical testing, and protect families' financial security in the near and long-term future as our nation contends with this crisis.
Much, Mr. Estes.
Thank you, Chairman McGovern, Ranking Member Cole, and members of the committee for giving me the opportunity to testify for this legislation tonight. It's unfortunate that we have to consider this legislation at this late hour with very little time to review it, and with the legislation being presented in a very unfair process. I mean, Republican members just had a chance to begin to review the legislation less than an hour ago. No hearings, no markups, no chance to fully review this important legislation. Mr. Chairman, we all care deeply about the economic and the health risks associated with this growing public health issue, but it isn't the right way to approach the issue. I mean, days ago, we just passed bipartisan legislation to provide over $8 billion in necessary funding. That conversation took place over 9 days. It was bipartisan from the start and resulted in real change in the lives of Americans. For example, more than $4 billion to make diagnostic tests more broadly available, to support treatments to ease the symptoms of those affected with the virus, and to invest in a vaccine development and to obtain vaccines when they are available. $2.2 billion for the Centers for Disease Control and Prevention for a robust response, including nearly $1 billion exclusively for state and local response efforts, and $300 million for CDC's Infectious Disease Rapid Response Reserve Fund to prevent, prepare for, and respond to disease, keeping our nation prepared and positioned for any health threat, and $20 million to administer disaster assistance loans for small businesses impacted by the virus. We certainly may need to take further action, but let's work together, not in a partisan way, a way that leaves out the other party in the dead of the night, in a manner that comes up with solutions that fail to protect the American people and keep our economy going forward. So tonight, Mr. Chairman, I'm here to listen and to learn about what's in this package because we've not had the requisite time to review it. Thank you for the chance to come and listen tonight.
Thank you. Mr. Cole.
Mr. Chairman, first of all, I want to thank you for holding the hearing. I know we're meeting under extraordinary circumstances, and I appreciate working with you. I was very impressed with the President's speech tonight and the manners he laid out, or the courses of action he laid out. Some of those things he can do by himself. In executive action, I think the travel bans, as my friend Mr. Burgess, Dr. Burgess mentioned, were wise from the beginning, and I think the ones he laid out tonight are as well. But some will require legislative cooperation. The President can't do on his own. So we'll be very interested tomorrow morning in seeing what the state of discussion is over the course of the evening and whether or not we can find common ground on those methods. And I know each side will be working in good faith to do exactly that. I have to say, Mr. Chairman, like you, I'm sure I have enormous respect for every one of the members here testifying tonight. I often say Congress is like a small town. Frankly, everybody knows who contributes to the Boy Scouts and the Girl Scouts. Everybody knows who ties to church. Everybody knows who you can borrow a lawnmower from, and everybody knows who brings the lawnmower back. And all these members bring the lawnmower back. So they're the kind of people you can trust. And so I listen with a great deal of respect and attention to what each and every one of them have to say. Like many of my colleagues, I regret we weren't involved a little bit earlier in this process. I haven't had a chance to read the legislation. It was largely developed by the majority. And sometimes, frankly, in a crisis, you have to do that. So I don't say that as an automatic objection. I just know that my colleagues will want more time to digest this, look at it. And again, as I said in my opening remarks, Mr. Chairman, I have no doubt there's many measures in this legislation that we can all agree on. But you'll, I know, understand if we need more time to read it and we need more time to consult with the majority. Finally, of course, Mr. Chairman, as you know, while I'm proud to be on this panel under your leadership, I'm an appropriator. So anytime I see my chairman and my ranking member together, I know I'm close to a deal. Because I've watched the chairman, the ranking member of the Appropriations Committee, my friend Chairman Lowy, my friend Ranking Member Granger work together for year after year, first on subcommittees, now as the chairman and ranking member of our full committee, and they always seem to find a way to bring us together. They did it last year. We were able to finish all our appropriations bill on time, and no offense to those of you that are on Ways and Means or Energy and Commerce, but we pretty much carried your stuff across the line. And it's no surprise to me that my chairman and ranking member have once been called upon to carry the work of multiple committees across the line. And that's what they're doing in this legislation. That's a very important thing. So I'll make you this commitment. If my chairman and my ranking member come together, I have no doubt I can be supportive of this bill. I don't want to put a special obligation responsibility on them because I know they have other people. But again, look, there's not a person around this table that I don't respect. There's not a person around the table that I know isn't bringing good ideas to the table for all of us to consider. There's not a person around this table that I know doesn't want to do the best thing for the American people in a time of crisis. And there's not a person around this table that hasn't demonstrated over and over and over again that they know how to work in a bipartisan fashion, and particularly in a time of crisis, for the good of the American people. So I think we're going to hopefully have a good evening of negotiation discussion. Again, like my friends, I wish we'd had a little more time to absorb some of the things my friends in the majority are putting before us, but I suspect you wish you'd had a little more time for some of the things the president put before us earlier this evening. That's fine. We're in a crisis situation. We all recognize that. We're going to have to move quickly. But I think we have the capacity to do that, Mr. Chairman, and I look forward to working with you and certainly all the rest of my colleagues, and particularly my chairman and ranking member, to make sure that we craft a package that actually works to the good of the American people, and we put aside whatever differences or concerns we have, find the common ground that I know that unites us all, and get something done, hopefully before we get out of here. I think it would be a shame for us to leave, honestly, without doing something together for the American people. I think they're looking for that almost more than the individual items in the package. They really want to see us, in a time of crisis, put aside differences, find common solutions, common ground that we can agree on, and work together for their interests. And if we manage to do that, I think that'll not only be good in a time of crisis, I think it'll hopefully reinstill some confidence in the process and the institutions that we all are very proud to be part of, and remind Americans that, hey, we're at our very, very best when we're at a time of crisis. We really are. So, again, my commitment to you, Mr. Chairman, is I'll work with you in good faith. I'll work with my colleagues in good faith. I know my colleagues in front of us will do exactly the same thing. Hopefully, we can do the right thing and get something done in the time that we have left before we leave, and go on from there. So with that, Mr. Chairman, again, thank you for your leadership. Thank you for the hearing, and thank you for the manner in which you lead our committee.
Thank you. Ms. Torres.
Thank you, Mr. Chairman, and thank you to all of you for being here with us today. You know, the hour is early. It's only 2 minutes past midnight. So I, too, want to get something done urgently and before we go home. I don't know how we go home to our constituents without dealing with critical issues related to coronavirus outbreak in our communities. I don't know how to tell a school-aged child in elementary school that is hungry and that their parent, unfortunately, is not able to work because they are a gig worker, because they work in a warehouse, and because they may be, just as was talked about earlier, working for an independent contractor. You know, my district works when China is fully operational. The goods that come in through the Port of LA and Long Beach end up in my district. The truckers don't have loads to bring to my district. The railroad folks are not working as they should be. The workers that are working within the warehouses don't have work. So many of them have already been laid off. What you will be experiencing in your districts when we hit the peak level of this virus, we are already experiencing it in my district. So I don't know how you would talk to a child who is hungry. Most of the kids at the schools that I represent are not only getting breakfast and lunch free and reduced or completely free lunch, they're also getting dinner. That's how poor they are in my community. I can't go home without a package that says, not only are we going to allow for a waiver authority, but we also need to streamline those processes. Because guess what? The school districts that I represent are also very small and don't have the capacity to fill up pages and pages and pages of paperwork that the federal government requires, for the purposes of transparency and accountability. All of that is good, but the time is urgent, and we have to deal with what is in front of us. And right now, I don't know what the housing market will bring. And I hope that all of us will watch the housing market, because in my district is going to be the first thing that will send an alarm that the rest of your districts are going to be impacted. I don't know how folks that are already unemployed, that have already been laid off, are going to make the rent or mortgage. We need to deal with that issue. And I understand that we may not be able to deal with all of it in 1 or 2 days as we move this package of bills forward, but I want some reassurances that the people that I represent are going to be taken care of. I want some reassurances that we are not only here to talk about the airline industry and the cruise ship industry and, you know, major employers. I want to make sure that we are talking about the small restaurants, you know, that are out there trying to do what is right by their employees, where they are saying, we currently do not have a paid sick leave, but for the time being, to deal with this issue, we are going to figure out and pay you to stay home, because we cannot afford to have you come to work and infect our precious customers. We want them to do that. We want them not only to be tested, but frankly, Mr. Chairman, in California, we have, where is the number here that I wrote down? We have 7,675 test kits. Test kits that, by the way, is like having, as LA Times explained it, it's like having printers without ink, because they do not have all of the ingredients. In LA County, a county that I represent, we have 10 million residents, yet only 72 people have gotten tested. That is unfortunate. This is what we need. We don't know what is out there because people have not been tested. The president's comments today are still being corrected online. We cannot speak from a point of misinformation. That is something else that we need to deal with here, because the president of the nation is the highest authority. And when he goes out there and speaks, the nation listens, and we should try to believe him. But how could we when after tonight a scripted speech has to be corrected? Secretary Mnuchin was in one of our financial services committee this week, and some of the comments that I made to him dealt directly with, if you're going to work on an issue to help large, business and Wall Street, you need to ensure that I can support a bill that would support the workers that I represent. Last week, at a meeting with the Export-Import Bank, Chair Kimberly Reed stated that the U.S. Commerce Department is still promoting the sales of critical supplies that the American people need. What are those critical supplies? Masks, hand sanitizer. How can, what happened to America first? We need those critical supplies here. So part of what we need to do is direct these uninformed officials that the left hand needs to talk to the right hand. That maybe the Commerce Department should be consulting with this new coronavirus committee that has been set up by the president. Those are the things that we cannot leave undone when we leave here this week. So I hope to be able to get more information from all of you, but certainly reassurances that those employees in my district are going to be helped, and that They are not just being demanded to continue to pay taxes to bail out Wall Street while they're struggling to pay rent and to feed their children, and I yield back.
Thank you. Ms. Lesko.
Thank you, Mr. Chair. I have actually some questions to whoever can answer them. I think I'm kind of trying to read through this quickly, and there's some things in here that I may be amenable to, like emergency paid leave benefits for people that actually have coronavirus, or they have to be quarantined, or they have to take care of someone with coronavirus. But I have a question. Is there more in here on paid sick time than just relating to coronavirus and those, and taking care of someone with coronavirus? Do you have a whole new policy in here?
Triggering action is a health emergency declaration.
So we're not changing anything except just for people that have coronavirus regarding paid sick leave?
That's the only health emergency that's been declared at this time.
And then as far as there's like nutrition waivers for the school lunch program, SNAP waivers, do we have any idea, is there any cap on the amount of money we're going to be spending?
Well, we don't know how many schools are going to close, so we just want to make sure it's there and available. That's on the school part.
Yeah.
Somebody else can comment on the SNAP benefit.
Thank you. Well, I think it's important that we help people that have, are being quarantined or becoming sick if they don't have sick pay and that type of thing. I think that's a good thing, but I really also think we need to be responsible. And so if there's things in here that aren't related directly to the coronavirus and they're just things that my Democratic colleagues want to put in here in an emergency measure, then that troubles me. So I'll have to wait and see what's all in here. Thank you.
Mr. Chairman, the hour is late, but just to respond a little bit.
Put your microphone,
First,
make sure your mic's on. Yeah, okay, all right.
First of all, as we know, the hour is late, and because of the urgency, and we heard the president talk, and we've been hearing reports every day, whether it's in my district or other districts, so we may not be as exacting in our presentation, but in your question, the number 500 million to provide access to nutritious foods, et cetera, was an estimate because of the burgeoning cases. I mean, this is an emergency. And you asked about the Emergency Food Assistance Program. We have there $300 million for the purchase of nutritious food. I wish I could give you all the details, but I know schools are closing, businesses are closing, and we have a responsibility to feed people. Thank you.
Thank you very much. I appreciate that very much. Mr. Perlmutter.
Well, I don't really want to be the fly in the ointment, but I'm going to ask.
You're going to be.
But I'm going to be. And I would say to Mr. Estes and to the ranking member, I mean, last week, this is what I got as to the $8.3 billion. And I appreciated this information, but that's all I got before we really voted on the thing. This week, I got this. How many hearings have we had on the bill that we've had before us tonight? None. Zero. I mean, that is a problem, and my Republican colleagues have complained about it, but I, as a Democrat, want to complain about it too, because there's no question we have an emergency. Part of our emergency is we want to try to get out of here by tomorrow afternoon, or this afternoon. Okay? I mean, we're setting our own deadline here. Isn't that true? Am I mistaken on that?
Well, look, I'm a big advocate for regular order. We don't always follow.
Yeah, well, this is about as far from
But you're
regular
not going to
order.
have, you can't have regular order when you have an emergency. I mean, you know, it would, for us to go to
And Mr. Chairman, I appreciate that. But I guess I would say is, okay, why aren't we doing this, Friday? Today is what, Thursday, now that we're 12:15, Thursday? Okay, so I just want to get that out of the way. And so for those of you that don't think you've not had enough information, this is very limited for us too. And I think for everybody sitting around this table as well. And this is big stuff. If Angela Merkel's estimates as to what's going to happen in Germany are even close to what might happen here, we're talking 198 million people potentially picking this up, of which 158 million would be mild to moderate, which leaves you 40 million severe. So I guess I'd ask the witnesses. One of the things we've seen in the state of Washington, in the state of New York, and the state of Colorado is the need for the National Guard and the Army Reserves, the reserves. Is there anything in this bill or the other bill to cover the cost of calling out the National Guard?
I'm not, maybe I shouldn't answer, not being an appropriator, but the bottom line is, as you can tell, you mentioned the 8.3 last week, you see what we're doing now.
My daughter changed my ringtone, I'm sorry.
We're going to have to,
Good ringtone for this time of night.
You know what, it's called sicko mode.
I don't think you should assume that what we're doing today is comprehensive. It's responding to concerns that we've been able to identify and that we think we can move on quickly. But I don't think anybody at the table would argue that more is going to have to be done as time goes on. This is simply a response to the things that we think need to be done quickly and can be done quickly. It's the best response I can give you.
I guess what I'm seeing, I mean, unemployment insurance is one thing, but that happens over a long period of time. And in fact, if I read this, I'm not quite sure. So then we've got the few-page kind of outline of this, and I'm trying to understand on the unemployment insurance. 500 million would be reserved for emergency grants to the states which experienced at least a 10% increase in unemployment. So my question is, Colorado, we have a 3% unemployment right now. So does that mean we got to go to 13% unemployment, or we go to 3.3% unemployment? Does anybody know? See what I mean? It says 10% increase.
10% increase would be 3.3.
So, okay, which is a lot better than 13%, but I'm not quite sure from the summary.
10% above 3.3.
You said 3%, now if it increases 10%, it'd be.
It would be 3.3, not, I wouldn't have to go to 13%. I wouldn't have to have a 10% on top of,
10 percentage points.
okay.
It says 10%.
All right, then I appreciate that. But again, that's looking back a year. I mean, some of these things are emergencies, clearly the testing, but I thought part of the testing was what we did last week.
The testing is essentially the authorizing language. In other words, it's not the spending. What we're saying is that, whether it's federal programs like Medicaid or Indian Health Service, or it's private insurance, or for the uninsured, we want to make sure that everybody can have the test and not have to pay for it, not have to have any copay, deductible, or out-of-pocket expenses. That's what we're doing with that.
And some of this ought to be done anyway. I mean, if you're taking a vaccine, that should be under prevention. It should be under most plans, no copay and deductible. So it's not a new idea.
And what we did last week was to give the money to states to actually purchase and have these kits on hand. Because what we're doing now is for individuals, to make sure that the individual who's trying to seek testing actually it's free of charge, whether you have private insurance, government insurance, or no insurance, that the testing would be free.
All right, so would last week's bill, would that have covered the protective gear for the health providers and the tents and the ventilators if we
Yes.
try to separate? Okay. Mr. Burgess.
I don't know about the ventilators, and that's a very good question. We can understand that perhaps on the testing, there were things that could have been done better. Can you anticipate what the next part of this crisis will be? If you look at the experience in some of the other countries, the next part of this crisis is going to be an overwhelming load of patients in acute respiratory failure presenting to hospitals, needing ICU beds, needing ventilators. I don't know if we have the capacity. I don't know if anyone has done a survey of unused military facilities that might be available. I don't know if, as part of the Ready Reserve, someone has looked into it. Again, that would be one of the questions I would have asked had we had a hearing, but I do think if we want to think over the horizon, we do need to think about the significant number of patients who could be in acute respiratory failure. And the stories, and I realize you're reading them online, I'm reading them online, I don't know if they're true, but the crowd out of people with other medical conditions who show up at the hospitals who can't be seen. Acute appendicitis now can be a fatal event because everyone else is tied up taking care of people who are dying of pneumonia. So it is something we need to think about. I don't know if we've addressed it in this bill. I don't think we addressed it in the appropriation last week.
So, Mr. Chairman, and further comment, I think the suggestion by the gentleman from Colorado is that these are brand-new ideas. I'd just like to go through the things within our jurisdiction. The OSHA regulation on infectious disease has been on the regulatory agenda for 10 years, and we've been writing them frequently to try to get them to move on it. It was just about done under the Obama administrations. Under the insurance plans, as I indicated, that should be, under the ERISA plans, that should be prevention, no copay and deductibles. So that's just implementing clarifying and making clear what we had. For the school children, the Department of Agriculture has the authority to do these waivers. There's a couple of tweaks just to make sure there's nothing in the way for them doing it. And the paid sick leave, we did have a hearing on paid sick leave this afternoon. It was more generic, and so we asked many questions on the emergency aspect of that issue. So we have deliberated, at least in the issues in the Committee on Education and Labor, we have deliberated on these for some time.
Okay, I guess I just, it's late and I'm grouchy and I apologize, but, we've got sick leave in here, we've got sick leave, unemployment insurance, nutrition, and testing coverage, so nobody has to pay a copay. That's what we've got in here. That's the bill.
That's pretty much it. There may be a few other things.
Do we know, obviously, none of us have really seen the bill. It just was finished a few minutes ago. Do we know, often Mr. Cole says, this doesn't have a chance to pass the Senate. Why are we wasting everybody's time? I assume you didn't say that today, so we think it does have a chance to pass the Senate. Do we think they're going to add some things to this? We'd have to come back next week?
I think the hope is that they will take it up and pass what we passed, but it's very possible what you're suggesting, that we might have to come back, sure. But there have been very serious discussions with the Senate, so you're correct in saying that we do hope that the Senate will pass it and that we think we have a reasonable chance.
But people are losing their jobs, being sent home from work. A lot of people are going to need the medical leave, paid medical leave. And the last thing we want is for people not to go home and stick around and infect everybody.
Mr. Perlmutter, I just want to go back to what my friend, Mr. Cole, said before. A lot of people work very hard, you can see all these committees, to respond to the urgent situation in communities across the country. I'm not going to come here and say this is perfect, but I know there are an awful lot of people that were using their expertise, as my friend Mr. Cole said, to try and put together a bill. I hope it passes the Senate, and I hope this becomes law, because there are an awful lot of people out there that are depending on it, and we have a responsibility to act. I'm not going to come here as the head of appropriations and say this is the most perfect bill we ever did, but I know how hard all these people worked on it, and I would hope that you give us all the benefit of the doubt, listening to the news and hearing people dying, and we just have to respond.
No,
This is the
and
best
Madam
chance.
Chair, I do give you the benefit of the doubt. And I've been, this is the first time I've really questioned our side or anybody in a more critical way, because I do trust you all. Okay? But this is happening very fast, but we're also, getting calls. I'm not bringing the National Guard or FEMA or the reserves up just out of the blue. I mean, we know that, and Dr. Burgess was just saying it, we're going to have something where we separate the coronavirus population from the rest of the population in these hospitals, so that everything can continue without all the medical providers being sidelined because they have to be in self-quarantine, and that's going to cost a ton of money. And it may be next week's supplemental, and I get that. This is the first time I've had to comment on either of these bills. And I guess that's why I'm doing it at this late hour. But, we're seeing that. There's this great new medicine, or it's an old medicine, chloroquine, which apparently has been working great for South Korea and China, but they just bought everything, and there's none of it left, that works as a therapeutic and things like that. So I apologize for my grouchiness, and I support you in getting this done. It is an emergency that we face, and it's huge. It's bigger than anything I think any of us have really seen before. And I thank you for the time you and your staffs have put in. I just would say that there are other people that can add to this conversation from time to time, and that's kind of what you're hearing from me.
First of all, I thank you. And unfortunately, given what's happening out there, there may be many other conversations and many other bills. And I just hope the intensity of this doesn't really bring us back over and over again to respond. But this is the best. I won't say it is the best. This product is a result of a lot of people working very hard. So we just hope we can get this done tonight, and then hope we'll have an impact. But this is one of the most serious situations, frankly, I've been a part of, and I've been in the Congress a long time. Thank you.
I yield back.
I thank the gentleman. Ms. Scanlon.
Thank you, Mr. Chairman, and thank you to our House leaders who've been working so diligently and realistically to assess and confront the challenges that we're facing with the coronavirus. I understand there's discomfort with the speed with which this has been presented, but frankly, I'm more concerned that our failure to act swiftly would be a disservice to our constituents. This bill contains a number of provisions that are really important to my community. First, it tries to ensure that testing is available without cost to everyone who needs it, whether they have private insurance, government insurance, or no insurance, because the only way to protect all of us is to make sure that everyone who needs to be tested can be, and that an inability to pay isn't going to tempt those who can't afford testing to skip it and endanger the rest of our community. Second, I'm heartened that the bill contains measures that will allow working families to follow the CDC guidelines when needed to quarantine or stay home from work to mitigate the spread of the coronavirus, because that appears to be our best defense at this point. Most families don't have the luxury of being able to forego a paycheck or stay home until the threat has passed. Think of a food service worker, a single parent, an Uber driver, families who live paycheck to paycheck. This package is going to protect those working families and the rest of us, right, by providing paid time off from work if needed. We don't want to force people into an unfair choice between risking communicating infection and paying the rent or feeding the families, and that's a win for all of us. The bill also provides emergency food assistance for school children, seniors, and others who might otherwise go hungry due to school closures and work disruptions. And finally, we have so many hospitals in my district. The bill requires that OSHA develop standards to keep our frontline healthcare workers safe. This bill's the strong medicine that we need to address the coronavirus. While we may need to refine the legislation as we go forward, I think it provides a strong foundation to move on. The only way we can protect all Americans is to ensure that the most vulnerable among us are protected. So I look forward to working with all of my colleagues as we go forward. Thank you, Mr. Chairman, and I yield back.
Thank you, Mr. Morelli.
Thank you, Mr. Chairman. I just want to thank all our committee chairs and the ranking members. Obviously, this is a difficult time, and I think people are responding appropriately. I do have, I think this is in Chairman Pallone's basket, just a quick and somewhat parochial question. With regard to the FMAP, New York State's Medicaid has a somewhat unique cost-sharing system between the state and its localities, including New York City. After some confusion earlier today, I understand the bill recognizes that unique system, and accordingly, the FMAP dollars will go to both the state and its localities. Is that your understanding as well, sir?
Yes.
Very good. Thank you, Mr. Chairman. Thank you all.
Mr. Chairman,
It's not sicko mode, but it's good.
Mr. Chairman, I have a completely different take on this bill. I think it's a mental health bill. I think it's a bill to reassure and reduce the anxiety and the fear that's out there in this country. And if you look at what our distinguished members did in this bill, they went into their toolbox, they took existing programs that we've had hearing after hearing on over the last decade and focused those programs on this particular virus and this set of fears in our communities. And if you look through each of these programs, whether it's expanding food assistance or free testing or paid leave or enhancing unemployment benefits or protecting frontline health workers, there is exactly what you would do next to focus on people and on families, to reassure them that as this virus is passing through our communities, we will have a support network coming from the federal government to help them get through this. So I refuse to turn myself into a pretzel. There is nothing really new in this package, except that it's focused very carefully on supporting families that are scared to death about this virus. And I think that it goes a long way to reduce anxiety and fear in our communities. It's not perfect in the sense, like the first bill we passed, that was the down payment. And this is a second down payment. And I can't see why anyone would object to any of these individual programs or argue that we should have extensive hearings on them, since we've had hearings for years on these programs. We know these programs. We've taken existing platforms and simply built them up and focused them in a way that would support families in our community. So I strongly support this package. I have some ideas about the next package. Frankly, if we need to do the things that we need for our hospitals in terms of surge capacity, the president has to declare a national emergency, because that's the next piece to handle the surge capacity. And then we can start funding those pieces. So I strongly support this package, and I think that we ought to move on, Mr. Chairman. Thank you.
Well, thank you very much. Let me just, Mr. Burgess, Dr. Burgess.
I wonder if I might just be recognized to ask myself several questions.
You can ask you are a witness, and you are a member of the Rules Committee. You can ask yourself whatever you want to.
Really, this is more of an observation, and several people have spoken about testing at no cost to the patient. I think that's fine. I think that's a great idea. Do remember, someone has to administer the test. There has to be overhead paid for the personnel to be in the office to administer the test. Someone has to pay the liability insurance if the test is reported incorrectly. And someone is going to have to report the test to a patient if the test is positive. Someone has got to do the follow-through, because now a doctor-patient relationship has been established. So we do need to think about that. I'm not objecting to what has been described here tonight, but it seems to me that it's incomplete. And finally, I just wanted to offer the observation, this country's gotten through bad things before. This one is scary. I told you at the start, this one has bothered me more than any of the other infectious diseases I've seen in my time here. But this country has come through great crises before, and the American people do have a way of responding. We're the engine of innovation for the world, and I think people are looking to us to figure the correct way out of this, and I just pray that we know how to do it. Thank you. I'll yield back.
Mr. Chairman, could I say, I'm not going to suggest that everything that Dr. Burgess mentioned is covered, but it's not just the test, it's also the provider visit, the visit of the patient and the provider that's covered also without charge. But it may not cover, but it may not, I'm not saying it covers everything, but a lot of the things that he mentioned, it's not just the test, it's also the actual visit and the provider.
But with regard to what Dr. Burgess, his concluding statement was, I'm going to say something I never ever say, and that is I agree with Dr. Burgess. The deal is this is a scary moment, and we're going to get through it, and we're going to get through it working together. And I want to associate myself with the remarks of Mr. Perlmutter, our resident grouch, and that, this is not going to be the last time we're going to be dealing with a bill responding to this crisis. And I think, there are other members of our caucus, of your conference, who need to be included in these discussions about what is the most appropriate way we approach some of this stuff. And so we're going to have to be willing to reach out. And, we know that we have a crisis. We know it's going to go on for a while. So there's no excuse for us not to reach out to everybody in our respective caucuses or conferences. I'll just say I listened to the president's speech tonight. And I have some strong opinions about that speech and about his tweets and about some of his comments. But every time I think I want to say what I want to say, I think I have a ranking member on this committee who is actually reasonable and who wants to get things done and who is interested in results. And so I'm going to say nothing about what I think about what the president said tonight and about anything about the administration's policies up to this point. We need to come together in a bipartisan way to figure this out and to do right by our constituents and by the American people. I mean, that's what this is all about. I know all of you have come together, with this in the right spirit and in the right commitment to try to figure out how we get through all of this. And so what we're doing here, and we're going to report this bill out tomorrow, so there may be some changes that will be made overnight, but this is about trying to help our constituents. And I think that's what our constituents expect of us. So I appreciate all that you have done. Mr. Cole.
I just want to tell you, Mr. Chairman, how proud I am that the resident grouch was on your side of the dais instead of our side, which is normally our role. But I'm very proud of my friend from Colorado because he raised some good points. And look, as we said, we haven't had time to digest this bill completely, and I'm not critical of anybody. I know we're acting in an emergency fashion, and I have members in front of me that I trust a great deal. Even when I sometimes don't agree with them, I trust them as legislators and as people of goodwill. So we're going to work through the night to try and do that and try and show up with the attitude to do that. But I do put that caveat out. We're working on that as we speak. The second thing is, we are a legislative body, Mr. Chairman, as you've pointed out, and we'll work on this, but this isn't our last crack at us, and I don't think anybody believes this is the last time that you'll either come up here individually as committees or collectively as a group. But as my chairman said, look, we're all in this together right now, and I think this is a good faith effort. We'll see what we can agree with and what we can't, but I know other people will be talking about this through the night as well. And I also think we'll be back again. And if we get something wrong in a piece of legislation that this sweeping, and done this quickly, and it's done this quickly because it's an emergency. You know, it's not the way any of you would have operated or preferred to operate as legislators. I know each and every one of you want the hearings, you'd want the questions, you'd want the witnesses. But we don't have a lot of time, and as my good friend Ms. Torres pointed out, there's a lot of places that are in a lot of trouble right now. And so sometimes you have to move quick and come back and fix it later. And we may be in one of those situations. But the one thing I'll pledge to you, Mr. Chairman, is we'll work with you every step of the way and try and find a common solution, as I know everybody out there wants. And again, as I know my chairman and my ranking member always somehow seem to find. And if we can emulate what I've watched them do over the years again and again as a Congress, and what they've done as a committee, we'll get there. We'll figure it out.
I thank the gentleman, and again, I think the more we can aspire to getting bipartisan votes on these issues on the House floor, I think that's reassuring to the American people. But I appreciate everybody's work. I appreciate you all being here tonight, and I thank you, and you can leave. Right.
We burst in applause.
Yeah. And are there any other members who wish to testify in HR 6201? I see none. So this closes the hearing on HR 6201, and without objection, the committee stands at recess until 8 a.m. tomorrow morning.